Hello everyone, today's topic is about dehydration. If you like this video, please like, comment and subscribe my channel and also share it with your friend. It is the most important topic, so let's start. First, the definition of dehydration. Dehydration is an excessive loss of water from the body. So when in our body there is an excessive loss of water occurs, so in this time dehydration occurs. And this medical condition is termed as dehydration. Then minimum daily requirement of water intake is about 1 liter and this varies with the age and activity of an individual. The most active individual need 2 to 3 liter of water daily intake. Normally 1 liter is required daily, but in case of most active individual 2 to 3 liter of water intake should necessary. Then dehydration occurs when fluid loss more than what it is consumed. So if you consumed less amount of the water and the amount of the fluid loss is high, so dehydration occurs. Then the causes of the dehydration. First, gastrointestinal disorder. Severe diarrhea, vomiting occurs. Insufficient intake of water, renal disorder, excessive loss of the water through the urine, endocrine disorder like diabetes mellitus, diabetes insipidus, adrenal insufficiency, excessive loss of water through urine, excess sweating, prolonged physical activity without consuming adequate amount of the water in hot environment, use of laxatives or diuretics for loss weight quickly. It is the most common in case of athletes. So these are all are the causes of the dehydration. Gastrointestinal disorder, insufficient intake of water, renal disorder, endocrine disorder, for example, diabetes mellitus, diabetes insipidus, adrenal insufficiency. In this case, excessive loss of the water are released through the urine. Then sweating, prolonged physical activity when consuming a less amount of the water in a hot environment, use the laxatives, diuretics for losing water quickly. Then classification. Dehydration can be classified into three types: mild dehydration, moderate dehydration, and severe dehydration. First, mild dehydration. It occurs when fluid loss is about 5% of total body fluid. So, in the total body fluid, there are 5% of the fluid loss in occurs in the mild dehydration. It is not very serious and it is treated easily. Then, signs and symptoms of mild dehydration: excess thirst, dryness of the mouth and lips, decreased urine formation, dizziness, decreased sweating, darker urine color. So these all are the symptoms of the mild dehydration. Then treatment include: the best treatment of the mild dehydration is drinking water and stopping fluid loss. Intake electrolyte rich drink or ORS, oral rehydration solution. So full form of the ORS, oral rehydration solution, or diluted sports drink. So these all are the treatment of the mild dehydration. Then the second type is moderate dehydration. It occurs when fluid loss is about 10%. So in case of the mild dehydration, it is occurs when fluid loss is about 5%. 5%, and in case of the moderate dehydration, when it is occurs is about 10% of the total body fluid, then it becomes little serious. Immediate treatment should given by the rehydration. Then signs and symptoms of the moderate dehydration are excess thirst, dryness of the mouth and lips, decreased urination, dizziness, decrease in sweating, darker urine color, fatigue and lightheadedness, headache, muscle cramps. So the sign and symptoms of the moderate and mild dehydration is almost same. Then the treatment of the moderate dehydration may requires intravenous IV fluid replacement in urgent care setting or hospital. Make ORS at home by mixing 1 liter of water and 6 teaspoon of sugar and half teaspoon of salt. So 1 liter of clean water and 6 teaspoon of sugar and half teaspoon of the salt make an ORS, and in case of the moderate dehydration you can intake it. Then avoid. In the case of the dehydration, you must avoid steer clean of caffeinated drinks, alcohol or sugary sodas. You must avoid all of this. Then the severe dehydration. It occurs when fluid loss is about 15%. So in case of the mild dehydration, it is 5%. In case of the moderate dehydration, it is 10%, and in case of the severe dehydration, it is about 15%. Then dehydration occurs, becomes severe, and required hospitalized and emergency treatment. So in the severe dehydration, emergency treatment must required. Then when the fluid loss is more than 15%, dehydration becomes very severe and life-threatening. Then signs and symptoms of the severe dehydration: decreased cardiac output, decrease in blood volumes, low blood pressure, fainting, hypovolemic cardiac shock, reduced or no urine outputs, loss of skin elasticity. In case of the infant, a shrunken soft spot occurs in the top of the skull. It's also called fontanelle. Then the symptoms of very severe dehydration: mental depression and confusion, damage of organ like brain, liver, kidney, renal failure, and in some cases patient must sent to coma. Then the treatment. In the severe dehydration, drinking water alone is not sufficient because it cannot compensate the salt. In case of the drinking water, you can compensate water, but it is not compensate of the salt loss. So in the oral dehydration therapy, ORT is an effective treatment for the severe dehydration. In this case of the very severe dehydration, proper treatment is the intravenous IV administration of necessary water and electrolytes. Then loss dehydration is classified into three types. This is isotonic dehydration, hypertonic dehydration, and hypotonic dehydration. In the isotonic dehydration, when the amount of the water and sodium loss is equal, so balanced loss of water and sodium in the case of diarrhea or vomiting. Then hypertonic dehydration, loss of more water than sodium. So when the loss of the amount of the water is high and the sodium loss is less, in this case hypertonic dehydration occurs. And in the hypotonic dehydration, when the more amount of the sodium is lost than the water, so loss of more sodium than the water in case of the excessive use of the diuretics. Then there is some diagnostic test of the diarrhea. First, physical examination. Look for physical signs like low blood pressure, a rapid heart rate, reduced skin elasticity, and dryness of mucous membrane. And then blood loss. In the blood test, kidney function, level of electrolytes like sodium, potassium balance should be checked, and blood urea nitrogen burn test, creatinine test, complete blood test, CBC, hemoglobin and hematocrit level are checked in the case of the dehydration. Then urine test. Urine concentration, specific gravity of urine, dark concentration of urine with a high specific gravity is a sign of the dehydration. Then weight measurement. In case of the infant and children, recent weight change can be indicate of the fluid loss due to the dehydration, because in the case of the dehydration our weight become less. So these all are the diagnostic tests of the dehydration: physical examination, blood test like CBC, burn test, hemoglobin, hematocrit test, urine, complete urine examination, weight measurements. These all are the diagnostic of the dehydration. So I think this video is helpful to you. If this video is helpful to you, please like, comment and share it with your friends and subscribe my channel. So thank you everyone.